If you have been diagnosed with pelvic organ prolapse, then you must be wondering, can I still do my daily activities? Can I lift my kids? Can I exercise? Can I be intimate with my partner? Patients feel that heaviness, that discomfort, feeling of pressure, that uncomfortable feeling. They can actually see a protrusion coming out through their vaginal area. Truly embarrassing when you're trying to be intimate with your partner. Or are they going to make their prolapse symptoms worse? It's not going to kill you. 1 in 2 women who have had vaginal delivery will notice some degree of prolapse at some point in their life. Hi everyone, I'm Dr. Noor, a board-certified and fellowship-trained urogynecologist and a pelvic reconstructive surgeon, and welcome back to my channel. If you're new here and you like what you see, please don't forget to hit the subscribe button, and for those of you who've been following me, thank you for doing so, and welcome back to yet another episode about your pelvic health. Let's start with briefly talking about what is pelvic organ prolapse. So pelvic organ prolapse is a quality of life issue where, because of the weakness of your pelvic floor support structures, your pelvic organs, which could be the uterus, the bladder, the rectum, the intestines, are pushing through the vaginal wall. So a lot of the times, because these organs are trying to push through, patients feel that heaviness, that discomfort, feeling of pressure, that uncomfortable feeling. And oftentimes they can actually see a protrusion coming out through their vaginal area, which, as you can imagine, can be really uncomfortable, not to mention truly embarrassing when you're trying to be intimate with your partner. Also, anytime you put exertion into your abdomen, whether it be because of exercise, running, anything high impact activities, or even lifting things, lifting your groceries, lifting your toddler, any of those activities that puts pressure on your abdomen can actually put pressure on your pelvic floor support structures and make those pressure symptoms feel worse. So a question that I often get in my office is that, can patients with prolapse still continue to do these activities, or are they going to make their prolapse symptoms worse? And these are all great questions, because remember, pelvic organ prolapse is not an emergency. It is a quality of life condition. And what that means is that you don't really need to treat pelvic organ prolapse because it's not cancer, it's not a heart attack, it's not going to kill you. But to be able to live in a way with pelvic organ prolapse that actually supports your quality of life issues, you have to make some smart choices. So let's start with exercises. Is doing exercises okay with prolapse? So movement is always a good thing. Some of the safe options that I recommend my patients who are suffering with prolapse when it comes to exercises can be things like walking, cycling, swimming, yoga, stretching, modified strength training, and overall awareness of your breathing techniques. What is really important, and in fact what matters more than the kind of exercises you do, is to be aware of your breathing, is to make sure you're trying to engage your pelvic floor muscles whenever possible, and also having an awareness of load management. High impact activities like jumping jacks, running, sprinting are not necessarily bad, but you may need to consider some modifications. Maybe you need to support your pelvic organs using a pessary when you're engaging in these kind of high impact activities, or you may need to work with a pelvic floor physical therapist so they can guide you in a more individualized fashion as to how to engage your pelvic floor muscles when you're engaging in these kind of activities. The second point is lifting. Whether it's groceries, your toddlers, you do not need to stop lifting. But here are a few things to remember. Exhale on effort. Avoid holding your breath, because when you're holding your breath, it increases the pressure in your abdomen, which in turn puts a lot of pressure on your pelvic floor muscles and hence causing even more weakness of those muscles and worsening symptoms of prolapse. Lift closer to your body, and if you're carrying heavy things, if possible and whenever possible, try to break it down in smaller loads. And also use support when needed, whether it be a pessary to hold your pelvic organs or engaging in pelvic floor muscles so you can lift those pelvic floor muscles appropriately. Remember, your body is adaptable and you can absolutely teach yourself to engage your pelvic floor muscles appropriately whenever you're lifting something heavy. The most common question that I get from my patients is that, can I still be intimate with my partner? Can I still have vaginal penetration? And the answer is yes. Pelvic organ prolapse is a support issue. Engaging in intimacy or even with vaginal penetration does not make your symptoms worse. It does not spread. Prolapse is not something that's contagious. Your partner cannot make it worse. You cannot give it to your partner. So you can absolutely engage in intimacy as long as you're comfortable. Make sure you use positions that are comfortable to you. Make sure you're using appropriate lubrication, especially my patients who are going through perimenopause or menopause. I'm a big proponent of silicone-based lubricant because I do think it is more gentle on your skin compared to some of your water-based lubricants, and definitely not the sugar-based ones. If you're somebody who's using a pessary, ideally remove the pessary before you engage in vaginal penetration. And if you're still having pain with intimacy, make sure to see a urogynecologist or a pelvic floor physical therapist so we can assess your pelvic floor muscles and make sure there's nothing else going on that could be contributing to your pain. Next, I would like to talk about some daily tips that you can look into, especially if you're somebody who's living with prolapse and are not planning to undergo any surgical treatment anytime soon. Make sure to focus on avoiding risk factors that can make your prolapse worse. Things like constipation, chronic cough, being overweight, using vaginal estrogen when appropriate, considering pelvic floor physical therapy if appropriate, staying active and making sure you're dedicating a few minutes of your day to strengthening your pelvic floor muscles. These small changes can over time really help improve the health of your pelvic health and eventually help improve your overall quality of life, even if you're somebody who's living with pelvic organ prolapse. And finally, I want to say that just because you have pelvic organ prolapse doesn't mean you're broken. Pelvic organ prolapse is a very common condition. In fact, 50% of women, which means 1 in 2 women who have had vaginal delivery, will notice some degree of prolapse at some point in their life, and it can get worse for my patients who are undergoing menopause and after. It doesn't mean your body failed you. It doesn't mean you're fragile. This is a health condition just like anything else. With the right guidance, with the right treatment, you will be able to live a very fulfilling life, even with symptoms of pelvic organ prolapse. I hope with this video, I'll be able to alleviate some of your fears and concerns if you're somebody who's been recently diagnosed with pelvic organ prolapse or know somebody who has been. So if this video made you feel less afraid and more informed, don't forget to hit the subscribe button if you haven't already subscribed to the channel. If you also like to have more helpful information like this, then definitely sign up for my newsletter, the link of which will be down below, because every month I send out a detailed newsletter where I talk about some of the advances that happen in our field, what have I been up to, some educational points. Everything will be there packaged nicely for you right in your mailbox. And also, if you haven't checked out all the other videos I have about prolapse, pessary, and management of pelvic organ prolapse, then definitely check those videos out as well. I'll be back again next week with another engaging video about your pelvic health. Till then, stay well, stay healthy, and don't forget to take care of your pelvic health. Bye!